My name is Dr. William Stevens. I'm a spinal surgeon in Phoenix, Arizona. I did my medical school and college at Brown University in Providence, Rhode Island. Then did a residency in orthopedic surgery at Walter Reed Army Medical Center in Washington, D.C., and finished with a spine surgery fellowship at University of California, San Francisco in 1994. I was in the Army for a total of 11 years, part of that during residency, but after residency, I served at William Beaumont Army Medical Center as the chief of spinal surgery. I then returned to University of California, San Francisco as an assistant professor in orthopedic surgery and spinal surgery, training other surgeons to do spine surgery before moving to Phoenix. And I've been here since 1999. After having practiced in a lot of different environments, military practice, academic practice, and a group private practice, I still didn't feel that I had the setting where I could provide the best care to spine patients, and that's when I founded the Center for Spinal Disorders in 2003. The idea of the practice was to allow me to focus on my patients in the way that I wanted and provide the level of care that I thought that these patients deserved. Over time, I've tried to put that into words, and we've kind of come up with the idea that our practice is devoted to the thoughtful solutions to spinal problems. What I like to think differentiates us from other practices is encompassed in that idea of thoughtful solutions to spinal surgery. There's a lot of new technology for spine surgery, and it's very, very easy to focus just on a particular technique, whether it's minimally invasive surgery or artificial disc replacement. And when you approach it that way, it's very easy to lose sight of what's best for the patient because you're trying to fit the patient to the technology rather than the other way around. So our goal is to really consider the whole patient carefully and decide what kind of solutions work best for them. And I think that really does separate us from other practices that focus on technology first. I try to approach a patient's spinal problem by thinking about the whole patient, not just their back, but what kinds of things are they struggling with? What are they unable to do? What are their goals? What do they want to do? Are both the patient and I, as a surgeon, being realistic about what we can accomplish with surgery? And does my patient have a firm understanding of what the risks are? And a really good understanding of what the benefits are? What can we do for them? So that a successful result is something that we're all happy with, and in as many cases as possible, an unsuccessful result is avoided. My special area of expertise, I think, flows out of my training. I trained with Dr. David Bradford, who is one of the giants in spinal surgery and a true leader in the field, and I'm very fortunate to have trained with him. So my practice focus has traditionally been on the more complex spinal problems, including spinal deformity, complex things that arise after previous surgery in some cases, spinal tumors and so forth. Just the same, my goal is not to do the most complicated procedure but get the best result for my patient. And the best spine operation is the one that's done right the first time. So I enjoy simple procedures every bit as much as the more challenging ones. No matter how careful you are when you approach a patient's spinal problem, no matter how careful you are in surgery, the simple reality is when you're doing something as complicated as spinal surgery that there are going to be complications. I try to approach complications first by looking for them, making sure that I identify the problem as quickly as possible, by responding to them as quickly as possible, and then getting the best possible result, in spite of any problems that we may have had on the way. I want to maximize my patient's recovery, and I have more experience with complications simply because I accept complications from other surgeons and in the difficult cases that I take care of. So after a lot of work, there's very few problems that I have not seen and taken care of, whether or not it was my problem to begin with. It's kind of hard to answer how I settled on spine surgery as my specialty, but I think in the end, for most doctors, that decision of just what you do is probably more an emotional one than intellectual. I always knew I wanted to be a surgeon for whatever reasons back as far as I can remember, but never knew what type until I saw a scoliosis operation during my internship. And for me, that was the moment where I knew what I wanted to do. Besides being a spine surgeon, and probably even more important than being a spine surgeon, I'm a father and a husband. And my passion outside of that is riding my bicycle, which I think is reflected in my practice. I know how much I like to do the things that are important to me, and as a surgeon, I do my best to let my patients do the things that are important to them, and that's the most gratifying part of the job, is when someone comes back and says, you know, I hiked the Grand Canyon rim to rim, or I went skydiving again, or other things that maybe they shouldn't be doing, but that they enjoy. Those are the moments that make it worthwhile.